Kia ora and welcome to ECG Boot Camp, an introduction to ECG interpretation by a med student for med students. My name's Izzy, I'm a final year student and I've always found ECG really hard, so I want to show you a system and some tips and tricks that I've picked up along the way of my training. And before I get started, I also just want to highly recommend to you this book, ECG Made Easy, by John and Joanna Hampton. You can have a look at a digital version of it, but I've actually found it really helpful to just have a copy that I can thumb through from time to time, and I pick up new things every time that I read it. So this is video number 1, and it's ECG Basics. So we know that the heart is a muscle that works as a pump, and we know from medical school that the way that it contracts or beats is that there is a pacemaker within the heart muscle, and it's an electrical kind of heart muscle which creates an electrical signal which then spreads through a conduction system within the heart. So we've got the pacemaker normally at the sinus node, and we've got that signal spreading through various pathways to the AV or atrioventricular node, then down the bundle of His, which has left and right bundle branches, and that's down the interventricular septum between the ventricles, then through Purkinje fibres, allowing the signal to spread to the ventricles. And so this electrical signal causes the atria to contract and then the ventricles. And then of course everything relaxes so that we can beat again. So what is an ECG? Well, it's an electrical recording of the heart. And so we stick a bunch of electrodes, those dots, onto different places of people's bodies. And those electrodes record what the heart is doing, and from that, the computer that makes the ECG constructs things we call leads. What leads are is that they are angles of looking at the heart's electrical activity. And so we've got some leads that look at the electrical activity of the heart vertically or in the coronal or frontal plane. So those are our limb leads, which is 1, 2, 3. And then our augmented limb leads, AVR, AVL and AVF. So as you can kind of see on this diagram, all of those are looking at the heart in that vertical plane. We've then got what we call the chest leads, and the chest leads are looking at the heart in a horizontal plane. So they are our V leads. They haven't printed out especially well here, but they go all the way around there, from V1 to V6, and that's looking at the heart from different angles in a horizontal plane. So an ECG trace is basically a piece of paper that shifts over time. So it moves, we've got time here on the x-axis, and then here on the y-axis, if you like, is electrical signal. And the way that it works is that, say we've got kind of a 0 or an isoelectric point. For any given lead that you're looking at, a deflection or a movement of the ECG line upwards means that either a depolarization is moving towards the positive end of that lead, or alternatively that a repolarization is moving away from it. And for a deflection downwards, there's either a depolarization moving away or a repolarization moving towards. I hope I've got that right. And so the direction tells us what direction the signal is traveling in, and the size of the magnitude, the voltage, if you like, tells us how big the electrical signal is. And as we'll remember from the earlier parts of medical school, the basic bits of our ECG are going to be when the atria depolarize, which gives us a P wave, when the ventricles depolarize, which gives us a QRS complex, and then when the ventricles repolarize, which gives us our T wave. And we know that obviously the atria have to repolarize, but because that's happening at the same time as our QRS complex, that gets obscured on the electrical tracing and we can't see the atria repolarizing, even though we know it does happen. And on this one, just as an aside, there is actually a little U wave, which is just an upwards deflection at the end of a T wave, which can be normal, and we'll get to that later on in the series. So those are the basics of ECG, and in the next video I'm going to start teaching you a system you can use to interpret ECGs every time you look at them. So I'll see you then. Cheers.